Welcome to NCLEX Success Tutorial on Cardiac Catheterization in Pediatric. Pediatric cardiac catheterization is a procedure used to diagnose and sometimes treat heart conditions in children. It involves inserting a catheter, a thin, flexible tube, into a blood vessel and guiding it to the heart under X-ray guidance. Here's an overview of how the procedure is done, its indications, parent teaching, and nursing management. Procedure. Preparation. The child will be given sedation or general anesthesia to keep them comfortable and still during the procedure. The area where the catheter will be inserted, usually the groin or neck, is cleaned and numbed with a local anesthetic. Insertion of the catheter. A small incision is made in the skin and the catheter is inserted into a blood vessel. The catheter is carefully advanced through the blood vessels until it reaches the heart. Diagnostic tests. Once the catheter is in place, various diagnostic tests can be performed, such as measuring blood oxygen levels, pressures in different heart chambers, and taking X-ray images, angiography, to visualize the heart's anatomy and blood flow. Treatment, if needed. In some cases, certain treatments can be done during cardiac catheterization, such as closing small holes in the heart, widening narrowed blood vessels, or placing stents to keep blood vessels open. Post-procedure care. After the procedure, the catheter is removed and pressure is applied to the insertion site to prevent bleeding. The child will be monitored closely for any complications and may need to stay in the hospital for observation. Indications. Diagnosis. To evaluate congenital heart defects, abnormal heart rhythms, heart valve problems, and other cardiac conditions. Treatment. To perform certain interventions such as closing defects, dilating narrow blood vessels, or placing stents. Parent teaching. Preparation for the procedure. Explain to parents the need for sedation or anesthesia, the steps involved in the procedure, and any preparations required before the procedure, such as fasting. Understanding the risks and benefits. Discuss the potential risks, bleeding, infection, allergic reactions to contrast dye, etc. And benefits. Accurate diagnosis, potential treatment of the procedure with parents. Post-procedure care. Instruct parents on how to care for the insertion site, signs of complications to watch for, such as excessive bleeding or signs of infection, and when to seek medical attention. Follow-up. Provide information about follow-up appointments, medication instructions, if any, and any restrictions or activities the child should avoid after the procedure. Nursing management. Pre-procedure. Assist with pre-procedural preparations, such as administering medications as ordered, ensuring informed consent is obtained, and preparing the child and family psychologically. Educate the child and family about the procedure, what to expect, and answer any questions or concerns they may have. During the procedure, monitor the child's vital signs, including heart rate, blood pressure, and oxygen saturation. Assist the physician during the procedure as needed, such as handing instruments or providing medications. Maintain a sterile field and ensure infection control practices are followed. Post-procedure, monitor the child closely for any signs of complications, such as bleeding, infection, or allergic reactions. Assess the insertion site for bleeding or hematoma formation and apply pressure or ice packs as needed. Administer prescribed medications and provide comfort measures to alleviate any discomfort or pain. Patient and family support. Provide emotional support to the child and family throughout the procedure and recovery period. Educate parents on post-procedure care, including medication administration, activity restrictions, and signs of complications. Let's look at the next topic. Heart failure in pediatric nursing. Left and right-sided heart failure in pediatric patients can be caused by various congenital heart defects, acquired heart conditions, or other underlying health issues. Here's an overview of the signs and symptoms, medical management, nursing management, and parent teachings for left and right-sided heart failure in children. Signs and symptoms. Left-sided heart failure. Respiratory symptoms. Shortness of breath, rapid or labored breathing, wheezing, coughing, especially at night or when lying down. Cardiovascular symptoms. Weakness, fatigue, poor exercise tolerance, palpitations, chest pain, irregular heartbeat. Fluid accumulation, pulmonary edema, fluid in the lungs, leading to crackles in the lungs, increased work of breathing, and cyanosis, bluish discoloration of lips and nail beds. Right-sided heart failure, fluid retention, peripheral edema, swelling in the legs, ankles, feet, abdominal distension, ascites, weight gain. Respiratory symptoms, shortness of breath, especially during physical activity or lying flat, orthopnea, difficulty breathing while lying down, paroxysmal nocturnal dyspnea. Hepatic congestion, enlarged liver, hepatomegaly, jaundice, yellowing of the skin and eyes. Medical management, medications, diuretics such as furosemide to reduce fluid overload, ACE inhibitors or ARBs, angiotensin receptor blockers to improve cardiac function and reduce workload, beta blockers to manage heart rate and blood pressure, and inotropes such as digoxin to improve heart contraction. Nutritional support, ensure appropriate nutrition to support growth and development, possibly with fluid and salt restrictions based on the child's condition. Surgical interventions, corrective surgeries or interventions may be needed to address underlying congenital heart defects or structural abnormalities contributing to heart failure. Oxygen therapy, supplemental oxygen may be required in cases of severe respiratory distress or hypoxemia. Nursing management, assessment, monitor vital signs, including heart rate, respiratory rate, blood pressure, and oxygen saturation. Assess for signs of fluid overload or depletion, such as edema, weight changes, and lung sounds. Fluid management, administer diuretics as prescribed and monitor fluid intake and output closely. Educate parents on fluid restrictions if necessary. Medication administration, administer medications as prescribed, monitor for side effects or adverse reactions, and educate parents on medication administration at home. Respiratory support, assist with positioning for optimal respiratory function, provide oxygen therapy as needed, and monitor respiratory status closely. Nutritional support, collaborate with dietitians to ensure appropriate nutritional intake, including any dietary restrictions or modifications. Emotional support, provide emotional support to the child and family, educate them about the condition and treatment plan, and address any concerns or questions they may have. Parent teachings, signs and symptoms, teach parents to recognize signs of worsening heart failure, such as increased difficulty breathing, weight gain, swelling, fatigue, or changes in behavior. Medication management, educate parents on the importance of medication adherence, proper administration techniques, potential side effects to watch for, and the importance of regular follow-up appointments. Nutritional guidance, provide guidance on a heart-healthy diet, including recommendations for fluid and salt intake, and collaborate with dietitians as needed. Activity and rest, discuss activity restrictions, the importance of adequate rest, and strategies for conserving energy. Follow-up care, emphasize the importance of regular follow-up visits with healthcare providers, including cardiologists, to monitor the child's condition, adjust treatment as needed, and provide ongoing support.